Greetings. So, I have mentioned in some of these videos that I'm a healthcare finance consultant. Most people really don't have any idea what that means. So, I'm going to give a brief idea of what that means, and then I'm going to talk about 5 things that you probably don't know about healthcare finance. Some of these you're going to care about, some of you aren't going to care about, but I'm going to tell you anyway. And Frank's been a commenter on almost all the videos I've done this month. Frank, 2 of these are going to answer a statement that you kind of made, and we kind of talked about it a little bit, and I'm going to tell you what the reality is. So Frank gets a mention. So anyway, as a healthcare finance consultant, what I do is I work with hospitals to figure out whether they're coding different things properly, whether they're charging everything the way they're supposed to, which can involve actually not charging for certain things. I go through what's called the entire revenue cycle, which means from admissions, when you go into a hospital or physician's office and you give all that information, that's admissions. Charge capture, so what did they do to you? What did they do for you? Did they send you for lab tests? All that kind of stuff. To actually getting a bill out the door, to getting paid or having that go to a deductible, then having the bill go to you, and if you don't pay it within a certain period of time, it goes to collections, internal, and then possibly goes outside. There's compliance, which is part of revenue cycle, but in essence, I have the background and skills to address all of that. I've been a biller, I have been a coder, procedure coder, procedure coder. Not a diagnosis coder, although I used to read records and I had the knowledge on how to do that. It's changed since then. I'm not even going to attempt it now. But this is my background. I've had some great successes. I helped one hospital increase their revenue by $730 million in 1 year. That was an increase of over 100% for what they had before I got there. And I actually created something called a charge master, which means nothing to most of you, but I created for United Arab Emirates back in 2009. So I've done some pretty good things, but that's here nor there. None of you care about any of that, but I just wanted to give a little bit of background. I've been doing this since August 2003, so almost 35 years. So I kind of know what I'm talking about. Anyway, here's 5 things you probably don't know. Some of these, maybe, like I said, you might want to know, but they're definitely going to teach you some things. The first thing is that healthcare finance is all about codes. And it really is. So I mentioned diagnosis codes. Diagnosis codes are known as ICD-9 codes. Right now, there are over 116,000 different variations of diagnosis codes. That's how come I'm not a diagnosis coder. Back when I used to know how to do some of that, and I just did it, because I had to read records to help to get claims paid and such, there were only around 11,000. So we went from around 11,000 to 116,000. There's just no way I could keep up with it. Those people have to be certified to do that job, and most hospitals won't hire those people unless they have experience, which is kind of a catch-22 because how can you get experience if no one hires you? Anyway, those are diagnosis codes. What I specialize in are procedure codes. So, in essence, if you go to the emergency room, there are specific codes for emergency, but there's codes for other things. If you've got a laceration and they have to sew it, there's a bunch of codes for that. If you need to get something out of your body, there's a bunch of codes for that. There's codes for everything. I don't know exactly how many procedure codes there are, but there's different types. There's the main procedure codes, and then there's what they call experimental procedure codes. And then there's, well, in essence, you call them HCPCS codes, which are additional codes. Some of them are for procedures, some of them are for supply items, some of them are for pharmaceuticals. Here's the thing about codes, and this is going to address Frank's first statement. If a hospital bill or a physician bill does not have a code on it, it cannot be billed to an insurance company. It just can't. Now, if you put a code on there, knowing that it's the wrong code or it's an invalid code, that's considered fraud. And that could cost you a whole heck of a lot of money. So that kind of answers that first thing that Frank and I were talking about when I did that video a couple weeks ago talking about me walking out of a situation that irked me when I was trying to see a physician. So, and it was a physician for the first time. They cannot bill insurance company without a code. The insurance company will deny, and they could probably turn you in for fraud. Fraud is usually limited to Medicare and Medicaid, and in other words, governmental fraud. But the Blues, because they're a monster across the country, could try to penalize you as well. And Blues money is good money. So that's the first part. Number two, healthcare billing isn't really about billing. So what happens is if everything goes through properly, if admissions has gotten all the information correct, which means they got your insurance information correct, they got your date of birth correct, if they have all that correct, if medical records got all that stuff that came across and it's all correct, if whatever service you had done in a physician's office or a billing office is totally correct, if everything is priced as it's supposed to be up front and that's done correct, if everything is correct, then bills automatically go out. Almost nobody touches a bill anymore. If everything is right, if the edits in what they call scrubbing software are totally clean, then bills go out. There are some exceptions. For instance, in some states, you can't send workers' comp claims or no-fault claims electronically because there's different types of information that you need. But in general, I'll say 95% of claims go out electronically. No one sees a bill. So what is actual billing these days? Billing is two things. One, it's follow-up on claims that weren't paid or weren't paid properly, or it's looking at claims that did not pass all the edits. And now, in essence, billing, it's a misnomer, but now they have to go and try to do research to figure out, okay, where was the breakdown here? Why didn't this bill go out? Quite often, billing doesn't have a clue. It has to go back to someone else to look that up. That's why calling it billing is a misnomer. That's why these days they'll go by patient financial services or patient accounting. But everyone always wants to call billing, and billing doesn't know all those answers. That's not really what they're for. So that's an interesting thing. Number three, this answers second part of a Frank statement, although he didn't necessarily ask this, but it was kind of implied. Just because you're charged for something doesn't mean you have to pay for it, but there's a caveat. So this issue we were talking about was going to a physician. And there are a lot of physicians who, if you miss an appointment, they tell you in their notes, if you miss an appointment and you didn't call ahead to tell us, we're going to charge you this fee. They can't bill it to an insurance company because there's no code for missed appointments. There's just no such thing. If they didn't see you, they can't do that. So they're going to send you the bill. Now, you're kind of in this catch-22 situation once again. Do I pay the bill or do I not? In essence, you don't really have to pay the bill. They can say, look, you knew what this was contracted for. We've seen you before. By the way, this can't happen if you're a brand new patient and they've never seen you. But if they've seen you, this is your doctor, then you can decide, you know what, I'm not going to pay that. The other side of that, however, is they never have to see you again because now you violated a contract. So if it's the only doctor in town or this was a doctor who was treating you right, you probably better pay the bill. But it's your fault if that happens because you could have just called ahead of time. Now, if you had an accident or an emergency came up, they're probably going to waive that because nobody's trying to be mean. But if you just, oh my God, I forgot the appointment, they're not going to buy that because they just called you. They send that automated call out. Or maybe they had someone in the office to call you. You know what? You're kind of stuck. Now, if you're in the emergency room and you didn't want to be there and you decide, you know what, I'm just going to leave, well, you just left against medical advice. And if you go to the emergency room, one of the things they have to do immediately is they have to triage you. So a nurse has to come out and verify that you are not critical. Because if you're critical, you're going to be moved to the top of the list. But if you're not critical, they've just examined you. Now, the thing with a lot of emergency rooms is that if you decide to leave, there is actually a code that they can bill for that. It's not that you left. The code is for the triage that was done. It's usually a very low fee, but once again, here's that caveat. You don't have to pay that, but if there's certain hospital services you're going to need later on, if your area does not have a lab and you got to get that done at the hospital, or does not have an outside x-ray department, and which means you have to have it at the hospital, you're going to have to pay that bill. If you don't have any of that stuff, or you decide that you're just always going to go to the emergency room, well, if you go to the emergency room, they have to treat you. They're still going to bill you, but you can always go to the emergency room. They can triage you. But like I said, once again, if it's not critical, they don't have to go any further with you. If you're having a heart attack, they have to treat you. If you have a gunshot wound, they have to treat you. But if you go in there and you had a bloody nose, they don't have to treat you because it's not critical. So there you go. You've got your caveats. But you know what? Pay the bill. But now, here's the next part. Number 4. There's always people in healthcare who are trying to help you pay your bill. There are notes all over the hospital saying if you need financial assistance, go to blank department. And I say blank department because sometimes it's held in admissions. Sometimes there's a specific department for it. In essence, these are people, they call it charity care, but it's kind of a misnomer. In essence, you can go to a department if you have low income, and they will try to see if they can qualify you in a certain spot. Now, in some states, like New York, if they determine that your income is really low, that you fit Medicaid guidelines, you now have to go through the process of applying for Medicaid. Medicaid will end up paying your bill, but that's what you have to do. If you have income that's higher than the Medicaid, then you have an opportunity to get on a sliding scale. Not every single hospital has this, but most hospitals do. So you may end up only owing 60% of your bill. Maybe 80%, maybe 40%. It's rare, but sometimes you can get your entire bill written off. You're just above Medicaid, but you're below this other scale. So that happens a lot. You have some hospitals that will let you sign up with a service that they've contracted with where the service pays for it, and then you just pay this service, this really low interest rate, so much per month to pay that off. Or you can set up a payment arrangement with the hospital, and so you can make a certain amount of payment with them. And they're not going to be overly mean. And I'm going to say 99.5%, because there are some big city hospitals where they're looking at these big dollars, and maybe you ended up with a $50,000 bill just because you live in a very expensive area, and you want to pay them $50 a month. They don't have to accept that because your $50 a month is never going to pay out that $50,000. However, they're going to try to find a way to work with you. So you take those shots. So, like I said, there's always someone who's willing to try to help you pay your bill. Even for physicians, they will do that within reason. Certain specialties might not, because they pretty much don't have to. You know, they're under no obligation. Surgeons are really under no obligation to do it whatsoever. But a lot of them will try to help you because they work with different hospitals, and hospitals do it. So a lot of physicians' offices will try to work with you. But you need to be proactive. Don't make them chase you. Always face those things up front. If you get a bill and say, oh my goodness, what am I going to do with this? Call somebody. You know, there's a phone number always on the bill. You can call them and set up payment arrangements. Actually, sometimes if you just start making payments on it, you know, whatever you have, if you can make a payment, they'll leave you alone because they're getting payments. A lot of hospitals have computer systems where if they get a payment, they automatically reset it. You didn't hear that from me. They need to fix that, but that's some hospitals. And here's the last thing you definitely need to know. If you have a big enough hospital bill or a big enough physician bill and you don't pay it and you don't try to get any help with it, it's going to show up on your credit report. and it counts. Back in the day, if you needed to go get a car or you needed to rent an appointment and you had a healthcare bill on a credit report, they totally ignored it. But around the early 2000s, they started looking at that. There was a stat that Suze Orman came out with. She said that 63% of all people who file for bankruptcy have a big healthcare bill on their report. Now, healthcare bills, like I said, you can pretty much at least get someone to work with you on things like that. And there, of course, there are some outliers. Chemotherapy is really expensive. If you don't have insurance to help offset that, that's a tough one. That's really tough. Certain types of surgeries are going to get you in trouble. You know, you have to do the best you can do. You contact someone, you try to see if they'll work with you. You know, like I said, no one really wants to hurt anybody. By the way, this is also the same with the IRS. If you owe any money to the IRS, if you call them, they will work with you. IRS will accept 20 bucks a month. As long as they get something, as long as you call them first. If they have to chase you down, there's trouble. So look, you just got an IRS piece of advice as well as the healthcare thing. So there's 5 things you probably didn't know, maybe you don't care about, but some of those things you just might find interesting. See, you never know what you're going to get. My name is Mitch Mitchell. I hope y'all have a wonderful day.